All right. So I guess we're ready to go. This is Dr. Dan. I'm an emergency physician by trade, former public health appointee of the Obama administration, and advisor on public health matters as it relates to the pandemic. Um, I wanted to basically summarize how we got here and where we need to get to. Uh, as you know, they're what we call zoonotic diseases, which are diseases where a virus or some type of infection may jump from an animal to another animal, but in this case, it jumped from an animal into a human. We've seen certain things like this. As you all are probably familiar, you're familiar with the 2003 SARS um, incident that occurred, and we also had H1N1. We've had MERS, which is Middle Eastern Respiratory Syndrome, and of course now, and we had Ebola, and we now have SARS-CoV-2 infection. The pandemic has changed the climate of the world as we know it, and we are going to be having to enter a new normal with a lot of paradigms that have shifted. So how it came about, whether it jumped from bats into humans, and that process on how it happened, the World Health Organization is doing an investigation on that, and that is yet to be determined, but science will determine that so we can have an accurate account. But the bottom line is we're at where we are right now, which is a pandemic that has affected lives and livelihoods. And at this point, we have to figure out how we get to that new normal. Well, vaccines and other therapies, what we call medical countermeasures in the biodefense world, are the way we're going to get out of that process, in addition to following public health measures such as hand washing, the wearing a mask, and social distancing. We've done some of our parts. We all are part of the solution. We all have been part of the problem, from our leaderships that leaders that we appointed, and to our also not being as compliant. So with these measures, I think some of us have done a good job. We need to do a better job, and that's talking to all of us, myself included, to ensure that we can be part of that solution. I received my vaccine. I received the Pfizer vaccine. You need to figure out your why and why not, why you want to take the vaccine or why you don't want to. But it's important that you get accurate, timely, digestible, understandable health information to then make your decision on your why. And that's what the public health campaign is about. Thank you. This is Dr. Dan. I'm done speaking.
Thank you so much, Dr. Dan, for that high-level synopsis of the history and also the process and why we're where we are today. And if anyone else can come on the stage to help contribute to this. While you're still here, Dr. Dan, I noticed the younger generation seems to be more hesitant in order to take it. And the vaccine, I have two daughters, one opted out to take it, she's a nurse, and the other one is going to take it. I'm in Tampa, and we see that here in Florida, but also across the country. Do you have any idea why the distrust may have occurred?
Well, great question. Distrust has been there because of a lot of reasons. The first reason is several governments and the medical institution have violated such trust, as we all know, due to different historical accounts of not getting informed consent, withholding treatment, and things like that. But even more so, even in the current day, access to care in different parts of the world, including our country in the United States. So we've tried to get to a different side, and we have to really communicate that story to the population, and also put our money where our mouth is, show the people that we do care, that we have that sense of community. We've been lacking that, and we need to be a part of that solution. So those are some of the reasons, of course, and then the age of social media and other outlets where media is democratized, so much so that anyone can put their ideas out there. All they have to do is sprinkle a little bit of truth on inaccurate stories, and people do a search. And once they find one word that seems to be true, it automatically becomes the rest of the words that are true. As you know, that's not the case. I have these discussions in my club, Health and Communication, and I think it's an opportunity for us to change the message and change the dynamic with regards to messaging and building trust among our community members, among our leaders, and our individuals, our family, friends, relatives, so that they have more trust in the medical system, and also so they're understanding the information so they can actually make their own informed decision without Big Brother or some other source telling them what to do. Thank you.
And I'm directing all the questions to you, Dr. Dan, because I know you have a limited amount of time. And I know I mentioned the younger generation, but I also have friends that I would consider maybe boomer millennials to the middle of the bell curve, who have said, it's not been FDA approved, which I know is also inaccurate. So I would love to hear your thoughts, because I've heard two school of thoughts. It's not that they have cut corners in terms of the FDA approval, but maybe have taken away some pre-COVID hurdles or red tape in order to address this issue, which I guess post-COVID we could learn, and maybe the FDA could also learn from that. What are your thoughts about that in terms of the FDA process?
Yeah, so they are partially accurate, so let's give credit where it is. It's not fully FDA approved, but it is approved under an emergency use authorization called an EUA. Why does an EUA happen is probably a better question. An EUA occurs when we're trying to approve a medication or a medical countermeasure, a treatment or a device under a guidance that we need more information and more data. But we don't want to withhold a likely life-saving therapeutic or intervention because we're waiting for more data. It means we have enough data to act reasonably to be able to say this is okay. However, to get the full approval, we got to crunch those numbers. I anticipate that they are crunching those numbers, and given that we've already, at least in the States, given the vaccine to over 100 million people, or at least with regards to the dosing, um, that is good news based on the data that we've seen in terms of outcomes and untoward effects and effectiveness, and efficacy within the trial and effectiveness outside of the trial. So all those bode well for it. So I wouldn't be surprised at the end of the year if we get some approval soon, on some of the ones that have been out enough that we've collected data on. So they are partially correct. It is approved under an emergency use authorization.
That's very good to know. Have there been any previous situation where the same strategy have been used in order for the FDA to approve under EUA? I'm just curious.
Sure, there have been many other incidents where the most recent I'll just throw out there is H1N1 when that occurred. So we had to move things quickly, and when I say quickly, we don't want, or at least the intent of the government, and I won't say we. I'm outside of the government now, but the goal was to save lives and reduce risk and reduce harm. So that was approved during those times, and there are many others that I can't cite. But H1N1 is a classic example. This pandemic is one, and if there's some other pandemic, which will probably occur at some point in time, those things may happen. I have to jump off my call now, but it's been a pleasure hanging with you all.
Thank you so much, sir. This is Angelique, and I'm resetting the room. We are typing why vaccines are safe and effective, and it's been recorded. Dr. Dan was kind enough to share about 15 minutes of his time where he provide an overview and history of how we are and why we are where we are. He definitely dropped the nuggets in the fact that the FDA has not really approved fully 100%. It's been approved under the EUA, which is for emergency use in order to save lives. And then hopefully after collecting data, then the FDA will probably turn around and fully approve the vaccine, which probably lends to the hesitancy of others in the world and the community who opt out to not be vaccinated. Probably when they say they're waiting, probably that translates into I'm waiting for the FDA to fully approve as opposed to just under the current approach. This is Angelique, and I'm done speaking. If there are others on the stage who wish to weigh in on this conversation, please do so at this moment. It's been recorded, so it would be great if we have the conversation keep going so we can reshare this critical information. This is Angelique, and I'm done speaking.
Thank you, Angelique and Dr. Dan. I'm Jason Jaramillo, MD, Internal Medicine, Critical Care, Brooklyn, New York. I think this got started with just a kind of general question that I posed in the last group. Just want to hear from people about their hesitancy or lack thereof, and hopefully we can kind of spread good information.
Hello, everyone. Can I ask one question, please?
You certainly can ask, Adam, and if we can't answer it, we will definitely find the right people after this record to get the answer. Go ahead.
Today I get the first shot of the Oxford vaccine, but I think in the early morning, and in the afternoon I feel like the side effect about a little bit fever. Sometimes I feel I'm very cold, and it's deep pain in the joint between the bones. I don't know, is this normal, or I have to visit the doctor, or what? Thank you. I'm Adam speaking.
I can only answer that as a person who have received the first shot. Total disclaimer, I'm not a clinician. I cannot be coded. Adam, I can only say that when I first took the vaccine about 2 weeks ago, after 24 hours, it was just extreme fatigue, a little bit of chill, and that was it. And from what I heard, that could be normal, but then we're as individuals, we may have different side effects. Again, this is Angelique. Just as a disclaimer, I'm sharing my thoughts from a patient perspective who have also received the shot, not from a clinician or any experts on this matter. This is Angelique, and I'm done speaking, and I don't know if others in the audience I see can weigh in on this question from.
Hi, Adam. Thanks for your question. I would like to just try to clarify terms. We often use the phrase side effect, which is a sort of unanticipated reaction to some sort of medical intervention. And what I would say is that these are expected effects of the immune response to the vaccination. Pain at the site of injection, fatigue, fever. This is an indication that your immune system is responding to the vaccine. And of course, there are very, very limited numbers of people who have complications of vaccination. I believe Allison can speak to this on a personal level, but pain in the bones, in the joint, that does actually sound somewhat unusual. I would give it a day, and if you're still feeling lots of joint pain, I would seek medical advice.
Okay, thank you so much. Thank you.
Thank you, Adam, and thank you, Jason, for addressing Adam's question. This is Angelique Robateau, one of the mods from MedStartr Health Innovators, and we're discussing why vaccines are safe and effective. To reset the room, we had Dr. Jen, who had to leave, that gave a great overview of the history, the process, and why we are in the current situation, and also why there are others who could be hesitant in taking the vaccine. He also confirmed that the FDA have not fully 100% approved these vaccines. It is more from an EUA perspective, and perhaps that's part of the hesitancy in others who opt to take the vaccine at this time, which is more of a wait and see approach, which is a personal choice. This session is being recorded, so if you come on the stage, just be cognizant of the fact that we are recording this. important session just to share with others who would be interested in this. Is there anyone who would love to join the conversation about whether it's safe and effective, or maybe even their experience if they've actually taken the vaccine itself? Okay. So I will continue the conversation as Salvina, thank you for joining the stage. Would you be so kind to introduce yourself and just weigh in on the topic?
Absolutely. Hello, everyone. I'm Salvini. I'm from the Netherlands, currently in the UK. I have a background in medical biotechnology, health economics, and have done my PhD within market access, specifically early market access programs to therapeutics, and of course, also compared that to vaccines. But I can't say I have, of course, COVID is a very new situation, so I'm learning just the same way as everyone else. However, I did have a question for any of the specialists regarding when it would be about perhaps for patients or for people with more serious conditions, such as if someone has had a prostatectomy, or people who are going through hyperbar therapy, which is also fairly new and innovative, and how maybe if the vaccines react differently, if they need a different type of vaccine for it, or if and how it could affect them, or if anything is known about the risks. Thank you. I'm done speaking.
Jason, is there any way you could weigh in on Salvina's question? Because I know I can't.
I'll give you what I understand. I'm a practitioner. I'm a clinician. I work in a hospital in Brooklyn that essentially turned into an ICU overnight, about 1,000-bed hospital. Regarding underlying conditions like past surgery, like a prostatectomy, I can't really speak with any authority on something like hyperbaric treatments. But really, people over the age of 65, people who are obese, who have underlying pulmonary or lung disease or cardiac disease, should be the first people in line to be vaccinated. They're the people who are most at risk of severe COVID and hospitalization and death. One of the positive findings so far, at least for the 3 vaccines that are approved in America, the Pfizer, BioNTech, Moderna, and Johnson & Johnson vaccines, is that each of the 3 of them are 100% effective at preventing severe COVID, hospitalization, and death. That doesn't mean that you can't unknowingly transmit the virus, and so that's why the public health recommendations to continue masking and socially distancing even after you've been vaccinated are still in place. But anybody with underlying medical conditions of an advanced stage, in particular, should receive a vaccine.
Thank you. And I have one more question, which is definitely up for debate here, and that's for anyone, any of the moderators. The general conversation I have seen around Clubhouse, or even, well, in the media, it's, they report that it's indeed preventative. But on Clubhouse, most of the conversations I've heard have said, let's be very clear that it prevents death, but not necessarily falling sick or getting ill. And I don't know how much that actually, prevents people from being hesitant to use the vaccines. So what would be your perspectives on that? Thank you.
Right. That's because when they did the preliminary trials of the 3 vaccines that are now approved under emergency use authorization from our FDA, those were the endpoints that were easily measurable. In my own clinical practice, we have a pretty decent vaccination rate around where I am so far. It's growing, thankfully, quickly now. And the trouble with COVID is that the large majority, I'm going to throw out a number like something like 90% of young, healthy people who contract the virus have very few symptoms or minimal symptoms, what we would consider kind of constitutional symptoms like fever, maybe temporary loss of taste or smell, some fatigue, recover just fine. It's the people who are older and sicker who die of it, and I think that was those were the endpoints that were measured when the emergency use authorization from the FDA compiled the data from the test trials of the two mRNA vaccines, Moderna and Pfizer BioNTech, and the Johnson & Johnson.
Thank you.
This is Allison. Thank you, Jason, for bringing that up. And so with that information, though, as far as, people who under the age of 30 or people, younger, not really experiencing severe COVID symptoms for the most part, do you think that this is something that's contributing to the hesitancy that's occurring among the younger populations? And does anyone have any insight? If you are in the younger population and you are hesitant or you have questions or concerns, please feel free to come up to the stage and voice those. Let us know what your thoughts are on that. This is Allison. I'm finished.
I would like to add a comment to what you just said, Allison, maybe because I think like a health economist, of course, but I'm assuming that the reason young people would be hesitant is because they see it in terms of cost benefit, where, they of course predict that they won't get ill so easily. So then they would rather avoid getting the vaccine, and they feel like they don't actually face as big risk as some of the more vulnerable people in the population. That would be a little extra point that I'd add. Thank you.
Very good conversation. I think what I also recalled before that there was a high percent of hesitancy in the medical population itself, which I think was surprising to the administration and also to possibly rolled out, because one of my daughters who keeps going back and forth is a nurse, and it's coming from her work environment, which seems to be would be like a contradiction to what it is that we're trying to accomplish. And I try to get more information as to why, but I think what Dr. Dan, who actually is a former advisor to the FDA and the CDC, and also a former Obama administrator, he did confirm that it's not FDA approved. And I think whenever that is heard, that's the narrative, that's the conversation, that becomes the collective thinking. So that could probably be part of it. And the younger generation, I think, because they have no symptoms here in Tampa, at some point you would never think there was a pandemic just because of the behaviors that you see in public. But one of the things that, and Dr. Jason, you could probably weigh in on this, and I could be wrong, but I think somewhere in the US, the variant that comes out of UK, I'm not sure which country, is now more prominent than the COVID-19, which is a concern because it's much more communicable with more severe symptoms. Am I right in either one of those statements? Hence the concern.
It's my opinion, personal opinion, that the concern over variants is slightly overblown. This is still the same virus. I like to remind people that the SARS-CoV-2 or COVID-19 virus is the 5th known coronavirus that causes disease in human beings. most people listening here have had a bout of coronavirus infection, whether or not they knew they had a coronavirus. It's a typical virus that causes cold-like symptoms. I'm also sensitive to the concern of younger people about the cost benefit of it. What I would always like to try to remind young people, and I have medical assistants of mine who are vaccine hesitant, is that in the same way that we wear our mask in clinical settings to protect us from unknowingly spreading the virus to our patients, the surest way of doing that is to vaccinate yourself. So it's a plea for a sort of selflessness to take a jab in the arm that may not provide much personal benefit, but certainly provides lots of benefit on a collective scale to the greater population of patients who are at higher risk of severe COVID and death.
Thank you so much, Jason. And you've been so instrumental in addressing some of the concerns that we're hearing on the stage as the experts, because I'm certainly not one to weigh in and form an opinion other than somebody who has been vaccinated. We've been doing this for an hour, and I know Alex, who is recording, was probably aiming for 45 minutes. We would probably go maybe for another 15 minutes. He cannot do anything because he's going to interrupt the recording, but this has been a great conversation. And to reset the room, we had Dr. Dan, who is a former Obama administrator and also in the public health space. He's also a former advisor to the FDA and the CDC. And as this topic very apparent, is the vaccine safe, and how do we all feel about it? And we've been sharing different thoughts, opinions, and also expert opinions and guidance. Dr. Dan was great in giving a history of it, and really talked about it not being FDA approved. And we've been having a very fruitful conversation with different thoughts and perspectives. If anyone would like to join the stage and share their thoughts from whatever lens, whether it's from a clinician lens, from a patient who have actually taken the vaccine, or just any thoughts whatsoever on this topic. This is Angelique, and I'm done speaking. Okay, I will continue the conversation. One of the takeaways that I have from this, for me personally, is the fact that it was not 100% FDA approved, because I literally told people that it was, so it's safe. Of course it's safe, but now I understand, for me, and maybe why others are vaccine resistant. And I know I stated before the younger population, but there's also a large percentage in the general population that's out to actually not take it. Some is not a wait or see game. Now, one of the thoughts that I have is that I've spoken to people who says, well, if it becomes a travel barrier, which means Florida have already opted out to not have a vaccine passport, then I'm going to take it, which to me negates their original hypothesis. If you were not going to take it for X reason, but you change your mind because you will be prevented to travel freely, does your full hypothesis remains? I wonder if anyone on the stage have thoughts around that, the passport, the vaccine passport, and any thoughts around that may become a requirement for us to travel and get back to some pre-pandemic lifestyle.
Yeah, I'll weigh in a little bit on that. Just for like a historical point of clarification, one of the reasons why approving vaccines has taken longer in the past is that when you study a vaccine that is not circulating widely, it takes more time to gather the data, and more people have to be infected and studied and their response to a vaccine, hypothetical vaccine in that case. One of the reasons why it was easier to do the EUA is that COVID is so widely circulating around the world that it was very quick. They didn't have to vaccinate too many trial patients to prove the efficacy of it. I'd also like to just point out from historical perspectives, a lot of people are kind of unaware of the vaccines that they've already received. Measles, mumps, rubella, hepatitis A, hepatitis B, tetanus, diphtheria, pertussis. These are common childhood vaccines that, at least in the United States, unless you've received those vaccines, you're not allowed to go to public school. And that's one of the reasons why nobody in our generation has known somebody to die of the measles or the mumps or rubella or pertussis or even hepatitis A or B. These were commonly common pathogens that caused a huge amount of morbidity, death in the past that we just don't have to think about because of effective childhood vaccine campaigns. I think it's important to realize that most of our best medicine is preventative medicine. By the time somebody reaches my ICU with severe COVID, our options are limited as far as treatment. We can give them extra oxygen, we can support them with steroids, but by far the best medicine is preventative medicine.
Thank you, Jason. I'm so glad that you said that. That is, speaking from, I'm not a healthcare professional, just as a disclaimer, but I was initially very hesitant about receiving the vaccine. I thought that it had been rushed, and the clarification that has been provided on that is that although it was produced fast and was made available to the public quickly, it did not cut corners on the testing for safety and efficacy. And, talking about the cost benefit analysis of young people, I know for me, learning about COVID long haulers, which are people who are continuing to have COVID or COVID-like symptoms for weeks or even months after being infected, that was a huge game changer for me, because a lot of the symptoms that they experience are also similar to a connective tissue disorder that I have. And, I was just like, if there's a possibility that this thing isn't just a couple of weeks and I'm asymptomatic, but it's more like, we have no idea how long that could last. There's no research. We're kind of still learning it as we go with that. And then also, I know that the more people become vaccinated, the quicker we can return to normal. And especially with things like vaccine passports coming out, or I don't know if that's the case, but, just discussion of that, and, will I be able to do this or do that if I haven't been vaccinated? I think that for me is something that changed my mind. And then, my family being vaccinated, my friends in the healthcare profession being vaccinated just kind of encouraged me. And I got my vaccine. I was very afraid that I would have symptoms or feel sick afterwards. And I mean, my arm was sore, getting a flu shot. Some people have had some mild fatigue and things like that, but the prevalence of really severe reactions is so small, that for me it was worth it to not get long haul COVID or not pass on the virus to a loved one or someone that I care about, and getting the chance to return back to normal and feeling confident. Although I don't think there's ever going to be a return to normal as it was before, but just kind of giving society a chance for that. And I do see that we have Jeff on stage. Jeff, did you have any questions, concerns, thoughts related to Nation? This is Allison. I finished speaking.
Hello, thank you, Allison. Yeah, I've been digging a lot into this. I think that I consider healthcare a personal issue. Something. So my thoughts are that I should do what's best for me personally, and I think each person needs to do a cost benefit analysis for themselves on is the risk of COVID greater or less than the risk of these experimental gene therapies, which is what they are. And I would
I'm
say,
sorry, Jeff. I'm sorry. I have to interrupt. These are not gene therapies. That is not true.
okay, well that's only what Harvard and MIT are saying. That's where I'm getting that from, because I'm not an immunologist or anything, right? So
these are mRNA vaccines.
Yes.
Messenger RNA is the way that you get from DNA to protein.
Yes. Can I speak for a second? Can I speak? Hold on just a second. Can I speak for a second?
But please don't speak on something you don't.
Okay, I'll just tell you exactly what Tal Zach said from Moderna. He spoke 3 years ago at a TEDx talk, and his video is available on YouTube. He was looking at damaged DNA from a cancer patient, and he has proclaimed that with an mRNA vaccine, they have been able to hack into the software of life. So that is his words and not mine, because again, I'm not an immunologist, I'm not a vaccine expert, but my personal opinion is that to coerce anyone to take an experimental, to be a part of a medical experiment under coercion is a violation of the Nuremberg Code. It's something we have to be very, very careful of, not to violate that. That is, a lesson that we learned from World War II. So there should be no coercion, whether it's a vaccine passport where you cannot work, you cannot travel, you cannot buy or sell without receiving this experimental vaccine. I think that's a violation of Nuremberg Code. Whether it is for your safety or not, that should not be a coercive thing that should happen. And I'm finished speaking. Thank you.
Thank you, Jeff, for coming on the stage. And for awareness, this is this session is being recorded. Excuse me. Why vaccines are safe and effective. So we are appreciative of the inclusiveness of everyone sharing their thoughts. And Jason, I know you were going to weigh in on Jeff's thoughts. Feel free to do so if you wish. This is Angelique, and I'm done speaking.
Yeah, Jeff, I don't mean to pounce at all. I don't want, there's enough misinformation at all. And I completely agree with you about coercion, this sort of thing. Obviously, I want people to make an informed, scientific-based decision on whether or not to vaccinate themselves, and hopefully a humanistic one as well. It's not just a personal thing in this regard. Vaccination programs work when there is large buy-in from the populace that realizes they can actually protect somebody else, somebody who is more susceptible to severe COVID and death, by vaccinating themselves. That's obviously a personal choice. You can't force people to be kind to their neighbors. But this is one of those sort of classic public health debates. Is it right that they put fluorine in the water to protect us from all getting cavities? Well, I would say yes. And this is a sort of classic medical ethic concern between weighing patient autonomy versus the sort of well-meaning paternalism of experts and authorities.
Thank you so much, Jason. And it's 4:16. We are going to go to 4:30, or an extra 15 minutes, and then we're going to wrap up. But to just do a synopsis, our Alex just decided to just start this room, and it has generated such a hearty conversation and also a wealth of information. So again, we heard from Dr. Dan. We also heard from Jason, who I consider experts in this area. We heard Jeff, who has a different thoughts. But what we love about MedStartr Health Innovation Club is the inclusiveness and the safety in which one can share their opinions and their thoughts and be respectful of those. And we see that demonstrated here in this room at this moment. Alison, I love the fact that you were able to share your journey through your hesitancy in taking it, some of the reasons why you digested or weighs the pros and cons, and your final decision as to moving forward. And I think that was very instrumental to be recorded and to be shared with others, because you logically and in a very strategic way, using data and other factors in your life to come from hesitancy to being proactive in what it could be if you didn't take it. And I absolutely love your thoughts on that. If anyone else would like to come on the stage and just weigh in on this conversation, which is really about the vaccine, this is the safety and the effectiveness, feel free to join us on the stage. And if not, follow anyone that you see in the room, especially the people that we have on the stage and the moderators, just so that you can follow further conversations. Sonia, thanks for joining. Can you say a little bit about yourself and your thoughts on this topic?
Hi, thank you for the room. The topic is really intriguing. By background, I'm an MD, although I have healthcare businesses now. And I'm really interested in how people feel about the whole vaccine passport scenario. I mean, the data clearly has, the data shows that, rollout has been fairly safe, and that, the effects of not taking the vaccine will be, more harmful to people's health than taking the vaccine. But given that, I'd be interested to just see what people felt about that.
I personally feel like we do ourselves a disfavor by referring to things as a vaccine passport. It really should just be voluntary choice on people's part to protect themselves, their loved ones, and strangers from unknowingly passing on the virus. Obviously, the reason why it's such an issue in public health is that a certain percentage of the population, estimated to be between 70 and 90% of the population, needs to have protection against the virus, either through natural exposure or through vaccine, in order to reach what is called herd immunity. And that way we can paint the virus into the corner and return to some sort of semblance of normal.
Having said that, the herd immunity could just be temporary, so I guess maybe that's part of the reason why there's a level of vaccine hesitancy amongst people. What do you think?
Yes, I mean, we have good experience from past infectious diseases regarding herd immunity. There is not a likely future where COVID-19, SARS-CoV-2 goes away. There will very likely be some amount of it being spread in the population at large, just as the other 4 known coronaviruses are present in the human population. The idea is that our immune systems collectively become effective at keeping the spread of the virus to a minimum, and herd immunity is more of a theoretical proposition than it is a scientific certainty.
Yes, it depends on the strains developed. Thank you.
Regarding the vaccine passports, I just want to mention that right now Israel is the prototype, and so if you want to look at how it will affect you if it comes to your country, you might want to look at Israel.
Thank you so much, Sonia and Jason and Jeff, Dwayne, and Sonia's question around the vaccine documentation. And Sarah, thanks for joining us on the stage. Can you share a little bit about yourself and your thoughts on the topic?
Hello, thank you for having this group. It's very helpful. I'm a pharmacist. Currently, I'm in management. I manage about 12 pharmacies. And my question is kind of related to that. So I know that our healthcare professionals in the hospitals, nurses and doctors, they went through a lot. And it's not just in this country, in other countries as well. So I feel like it is kind of our turn, maybe not to that level, but our team are pretty strained and, they were working really hard. We have Pfizer clinics. We try to vaccinate, 300 patients per day. And our pharmacists are under a lot of pressure, but they're happy to do that. And at the same time, they have to do the regular dispensing of medication and their other duties at job. My question is, what is your, I know that there are a lot of points that are not clear at this point, but what do you think is going to be the future when it comes to this vaccine? Are we going to need a second dose, like after 6 months or a year? Is it going to be kind of like flu, or we need the second vaccine, not the second dose, but the second set of vaccines after, let's say, 6 months? And so this is my first question. The second question, I just read, I guess, the study that came out today, I believe, regarding Pfizer vaccine that is not as protective against the African variant. So like mutations like that, do you guys see that another vaccine is being designed for, a specific variant that they, come out as we go? And honestly, if that is going to be the case, it's going to be a lot of pressure on our healthcare team and also population to just, keep up with these vaccines. Thank you.
I can weigh in a bit on it. Of course, the concern for variants is widely publicized in the media for good reason. There is already published data showing that both of the mRNA vaccines, Moderna and Pfizer BioNTech, are effective at preventing COVID at 6 months. Most clinicians believe that this is an underestimation. One of the optimistic sort of findings is the massive antibody response in comparison to natural exposure from the vaccines. And I'd also just like to reiterate that the antibody response is just the tip of the iceberg. That's just the beginning of the immune response, the humoral immune response. Humoral immune response leads to cellular memory response, and killer T cells are then educated on how to identify the virus if they're exposed in the future. I'm optimistic that in particular, the mRNA vaccines are going to be more protective for longer than we currently have data for. I'll also just throw in, just as a disclaimer, I received the Moderna vaccine. I was, one of the first in lines. I got my first shot the day after Christmas. I didn't have any major reactions. The second shot, I felt a little tired afterwards, as to be expected. But I really do see them as, especially the quick and wide uptake of them, as the way of controlling the ongoing pandemic.
Thank you, Jason, and thank you, Sarah, for your questions. And just for a full disclosure, this room is being recorded if you come on stage, just so to be aware of that. Ali, if you could share a little bit about yourself and your thoughts on this topic.
Yeah, this is, my name is Ali Al-Kafaji. I work in critical care at the University of Pittsburgh Medical Center. I'm really sorry, I'm driving, so maybe my voice is not very clear. I hope you can hear me well. I just joined the room really late, which I'm really sorry about that. I just was wondering, for the people in the room, what did you hear about concern about taking the vaccine? And just a disclosure that I received the vaccine in December, just like Jason did. I got two shots from the Pfizer vaccine. So it's just really more question than a contribution to this discussion, because you're going to always find the doubters. I mean, I can hear until today that there are some people who are actually doubting that there is something called COVID-19, despite we've seen multiple cases in the hospital who actually died from the virus. Some of these people, there is no question that there is no rationale, no discussion can convince them there is an infection, a virus called SARS-CoV-2. On the other hand, there are some concern that people are having from taking the vaccine, and the concerns that I've been hearing are, what is the long-term effect of the vaccine? There is no way you can tell anybody that they're going to have X, Y, and Z from that vaccine 5 years from now, because as all of you know, the vaccine hasn't been here for X many years. The vaccine has been, although the mRNA technology, I'm sure Jason had discussed this, it's been there for a long time. The vaccine is present since it came out in in December or maybe November. So I'm just curious, what are they worried about? Thank you, and I'm done speaking.
Can I respond to that? So there's more ways, there's more colors in the world than just black and white, right? There's more ways to deal with an infection than just a vaccine, right? So we had SARS in 2002, we had MERS in 2012, I think, and there were never any vaccines that came out of those at all. So there's other treatments, though, for viruses, and there are many that have been discussed, and I won't get into all of them, but other ways to treat illnesses and viral infections besides vaccines. So, there's
so your
typically...
point. So sorry.
Yeah, go ahead.
Your point is you would rather be treated for the illness than get protected by a vaccine. Is that your?
Personally, yes. I had COVID back in December, and because I've got a history of autoimmune disease, then I was very concerned. But even more so from my father, who has a lot of pre-existing conditions. And so I dug really deep, and a holistic doctor that I've used in the past has published a book back in November titled A Holistic Approach to Viruses, with 338 references. And so he goes through in that book just how to treat using holistic methods, which is one approach. I'm not saying that everyone wants that approach, but he has over 20 years with his protocol for treating viruses. And I personally have used him in the past to bring rheumatoid arthritis into remission. So I totally trusted what he had to present. And I went all the way through my COVID treatment within a week and a half. So it was very quick and very effective, and it cost me a whopping $300, which I didn't want to spend, to be honest, but is much better than getting into the hospital. So there's just many different ways, and I am a believer that people should have many different competing options when it comes to treatment. That's my personal opinion. But this particular doctor was threatened by the FTC because he posted blogs and also videos of interviews he did with patients on how he treated them. And the FTC came after him and told him to remove everything within 2 days or they would shut down his practice. So there's a one message allowed type of system that we have today. And I think the problem is just that we need to have competing information out there. We had $4 trillion of stimulus money for COVID, and yet how much of that went to testing and verifying holistic options? I haven't looked through the bills, but I would imagine that $0 went to holistic treatments and proving that yes, they are or are not valid. Thank you.
Thank you, Jeff, for your point is clearly I disagree with you, but your point is well taken. I can just tell you that you probably got lucky and you probably stayed at home, didn't go to the hospital. Certainly people who die from COVID-19, they die from multiple organ failure. That's what we have patients die from in the hospital, in the intensive care unit. And I can just guarantee you there is no holistic medication that can help in that regard. I feel that, many people who get COVID-19, they actually recover. Many patients who don't even need to go to the hospital. And our I don't want to say policy, but our take during the early in the pandemic, that if you are young and you have no problems with saturation, your oxygen, your lung, you're not short of breath, you don't need the ventilator, etc., you actually probably will end up doing good staying at the hospital, staying at home and getting treated. So maybe all the holistic medication you've taken would have not, you probably didn't need it, because you were not sick enough to go to the hospital. What I'm worried about the message that you will be okay taking, when you're really sick, taking, again, I'm not against holistic medicine, etc., but you'll be okay getting, treatment with vitamins and zinc and vitamin D, etc., at home, while you actually may end up having multiple organ failure, acute respiratory distress syndrome, etc., multiple, pulmonary emboli, etc., and then you end up dying. And if that is your choice, and I totally respect that, but people need not to be misled. And I feel that there is a lot of misleading information on the other side, that there is no COVID and you will be treated.
No,
I'm really glad that...
Yeah, I understand what you're saying. I understand, but certainly I know the address of my hospital, right? I know where to go if it got really bad. It never got bad like that. And so I was able to stay out. The problem that I point out is only...
This is Angelique, just to reset.
Yes.
Sorry to just interrupt Jeff and Ali, just because we had started this room around just for 45 minutes impromptu. But we were supposed to finish at 4:30. Alex below is recording. That's the red dot. And the way our strategy or approach with MedStartr Health Healthcare Club is that if Jeff, your mic is open. Sometimes when we do an impromptu room, it's just for this it's for the timeliness of the conversation, hence the reason for doing this room. But what we can do is definitely come back and have a continuous conversation, or we can even make this a repeated conversation. But just to be cognizant of the recording and the fact that it was supposed to be 45 minutes, I probably will wrap it up again in 10 minutes. I keep extending it. Alex cannot come on stage or anything because he's doing the recording on the back end. But we're going to go for 10 more minutes and then we're going to wrap up. I took off the raise hand in terms of others coming on the stage. But for everyone who found this conversation to be fruitful, please follow the club on top with the little monopoly, MedStartr Healthcare Innovation. We probably will definitely repeat this topic because of the interest that it has generated here in this room for the past 90 minutes. For those in the audience with the party hat, welcome. You are new to Clubhouse. Don't be shy if you return to come on the stage and share your thoughts. Your party hat is going to drop off in about 7 days. But to basically just recap, and Jason and everyone on the stage have provided such a hearty conversation in terms of is the vaccine safe, is it effective? And we have seen two different schools of thoughts. Ali, you came in the back end, but you definitely address the need to summarize that there are different thoughts and school and reasons and rationale or fear or distrust, misinformation, whatever the source or the reasons are. There's definitely a subset of the population that is absolutely doing a wait and see. The FDA is not fully approved, have not fully approved these vaccines, but as Jason mentioned, it's a matter of the uniqueness of COVID-19, the large population of having that population base in order to have these vaccines being tested and not have to have a full clinical trial that one would have in a different situations. So it has been a hearty conversation. We probably will wrap up in the next 5 minutes, but if anyone, especially you, Jason, just to have some lasting thoughts as Alex wrap up this recording, and then we will have a subsequent room. It would be much appreciated.
Thank you for hosting. It's really like my first day even getting into a room on Clubhouse, even though I've been kind of tangentially following for some time. I just like to say that we're all lucky that we get to speak with each other and speak candidly and honestly, and to hear people's concerns. I would just like to reiterate that more than 100 million people have received their vaccines. From a clinical standpoint, it's much easier to treat an allergic reaction to a vaccine than it is severe COVID. We can treat anaphylactic reaction quite easily, and that's why there's a waiting period after you get your shot. We cannot treat severe COVID. I've seen too many people die of this, and I'm optimistic that we can work together to turn the page and return to some sort of new normal.
Thank you so much, Jason. And Alison, as one of the moderators, do you want to just share some lasting thoughts?
Yes, thank you, Angelique. This is Allison. I think it's really great that we're having this room. And, those of you who are, concerned about getting vaccinated, this is a great space for, further looking into that. And I hope that we've shared some good information. We've heard some different opinions on things, and everything here is valid. Do your part, do what you can, and learn as much information as you can. And thank you for being here. This is Allison. I'm done speaking.
Thank you so much, Allison. And as we mentioned, I think Jeff and everyone, Ali, we know this is a personal choice, but it's also one of those choices that may have a greater impact on others. Like Allison, I myself, my entire family, except with my one daughter that is on the fence, has been fully vaccinated, and we just kind of want to have that safety experience as we move forward. Feel free to look to your left and right and follow anyone that you see on the stage or even below in the audience where you would have similar conversations going forward. MedStartr Club has at least